Get started. So thanks for joining us. Like I said before, we have a few discussions lined up today, so I do want to go ahead and get started. And hopefully these discussions will be super helpful to you all and valuable of your time. So as always, I'll go over the action agenda that we all created to remind us of strategy areas that we want to continue to work on. And then I'll also give a few updates on some of our strategy convenings that we've held so far this year. And then we'll have 3 discussions. So the first one will be on how health systems can contribute to food resilience. The second discussion will be focused on how we can leverage contact tracing and vaccine distribution efforts for food and nutrition security work. And then the third one will be focused on gathering information for countywide community health needs assessment. So we'll have a few breakout groups for that one so that we can gather some information from you all on the strategy areas that we selected. So here's our action agenda. The link to this is on the agenda for today's meeting. We also we have these overall themes of community partnership, economics, policy, and screening, referring, and partnering. So topics like entrepreneurship, procurement, a shared policy agenda, food access points, evaluation, all of those are reflected here, plus more. So we'll be discussing several of these strategies in our third discussion today, but I really just wanted to put this up as a reminder to the group for us to continue to work on all of these. And so we had a few convenings since we last met in January. And so we first had the FQHC feedback section on February 22nd, where we heard that there are some challenges around sustainability of services, connecting patients with referrals. Billing was a big one, funding, and then a couple of people mentioned just having extra space for pantry initiatives that they're working on. And so we will keep all of that in mind as we continue to cultivate partnerships this year. So I just wanted to inform you all of that one. We also helped to plan and held the first of 3 meetings for the Research Council convening this year. So that was on March 23rd. We had a very good turnout, and I saw a few familiar faces from this work group, so thank you for joining us. The topics for this year are food and housing insecurity, and our goal at least for this first meeting was just to learn about assets and gaps in research so that we can start to craft questions for a community research agenda. The goal of the second meeting, which will probably be at the beginning of June, so look out for that invite. But the goal of that meeting will be to use the notes that we took from the first meeting to craft and agree on the research questions around food and housing. And then in that third and final meeting, we'll be focused on finalizing the community research agenda and then fostering collaboration for projects, trying to make partnerships so that we can address those questions. So if anyone attended on this call, I'm not sure, maybe if you feel like you want to share thoughts or maybe something that you learned during that meeting. But other than that, I can say that from the notes, some of the research opportunities were around just strengthening mutual aid networks, assessing the Chicago food system landscape, addressing knowledge and literacy gaps, and also increasing participation in nutrition programs like SNAP and WIC and Medicaid. So does anyone have any questions around that before I move to the third one that we recently had? Let me check the chat. Awesome. And then for the third strategy convening we had. It was a webinar titled Medicaid and SNAP Dual Enrollment in Healthcare Settings. And so it was a really great discussion. Sarah from GCFD gave a nice overview of the process, what the application looked like, how the process is beneficial to healthcare organizations, and then she kind of provided like some facts around myths that may have been concerning some of the healthcare organizations. And then Lindsay from Lurie Children's presented on how the dual enrollment process was operationalized at their hospital, so that was nice. And she talked about implementation steps and lessons learned from their journey. So all of that was followed by a robust question and answer session. So we were able to kind of get a feel for what other organizations were already working on the dual enrollment process or thinking about it. So in the future, we're definitely looking at other ways that we can learn about each hospital's Medicaid process. So look out for that. If anyone else joined us for that webinar on the call, please share any thoughts. And I'll give a moment to see if we have any familiar faces on this call. Cool. All right, hearing none, and looks like the chat is very active. Yeah, thank you, Jess. So we'll definitely be putting the recording and slides from the webinar on our webpage for the Alliance for Health Equity. So now to hear from all of you, are there any other updates or opportunities that everyone should know about? The floor is yours. None? I know we have a lot of work going on.
Well, I can introduce myself briefly. It's the first time I've been here in a while. My name is Saria Lofton, and I work at UIC at the College of Nursing, and I've been working on a food access research with a couple of community partners. Some are here, and we're like doing some of the stuff that you all are working on around asset mapping. We're looking at assets and resources in West Garfield Park and Inglewood. And if there are any organizations that work in West Garfield Park, that would be, I would love to connect with you, because that's a place that I'm really trying to build more resources around to get more community folks. We're looking at community people and their expertise and how to leverage their knowledge towards solutions to improve access to healthy foods in West Garfield Park. So anyone who has that that I can connect with, would love to after this.
Awesome, yeah, and thank you so much for joining us. And I can definitely send you the notes and recordings from the first Research Council meeting. And then I'll also make sure to include you on the invite for the second one.
Thank you so much.
Any other updates or opportunities our work group should know about? And Lucy, thank you for putting the webpage link in the chat for us. All right, so now we can go ahead to our first discussion on how health systems can contribute to food resilience. So I would like to welcome and pass the mic to Stephanie from Brightbeat to introduce herself and share her thoughts around this topic, and then we'll hear from our peers at Advocate Aurora afterwards. So Stephanie?
Hi, everybody. Thanks for having me. I brought some slides that I hope maybe will just be beneficial for a visual instead of looking at this. So I'm going to see if I can share my screen okay. And can you see a big building that's, I live in Avondale, and that's just a shot I took of a building right here in Avondale. It's actually available now, unfortunately, a surplus asset that needs to be used. It used to house a big pinball machine company, actually. So anyway, I am Stephanie Katsaros, and I founded Brightbeat back in 2010. And we weren't really always in the food business. I worked with and still do work with many organizations and special events, really focused on maximizing resources, reducing waste, redistributing assets. And that could be building structures from a music festival. It definitely has always been very focused on back of house food waste, as well as educating the public through front of house programs. And front of house is kind of the event terminology. And I sit in solidarity with my event friends who have been out of work for a year now. It's a lot of us have found ways to kind of focus our efforts. And honestly, my work with the Wasted Food Action Alliance has grown to focus more on what we can do to support the food system. I think everyone knows this. I'm sharing this slide here, but food waste wastes everything. And so looking at this as a climate issue, not just a human issue, but both are obviously, all are obviously very important. Really quickly, so all of you are aware, there's an organization called the Wasted Food Action Alliance that I've been a part of since we were founded back in 2012, or sorry, 2016. There was a report put out by ReFed, which was initially a program of the National Resource Defense Council, but essentially really identifying how to prevent, rescue, and recycle food. And the key focus, you know, with the issues surrounding COVID, really understanding that the partnerships that could be formed within our communities to not just reduce waste, but really get food where it belongs and improve efficiencies and kind of the human aspect of the system. Really, a lot of what I've learned has come through, I'm skipping that, has come through the convenings. I recognize some of you through meeting with these convenings put together by the Chicago Food Policy Action Council, SIFPAC. Really, you know, food justice advocates and activists and stakeholders across the system, really across the city and the region, started coming together in March of last year. And you know, I worked and have continued to collaborate with individuals who are concerned around emergency food, worker and producer safety, and so on, as listed on this slide. Again, it's great to see familiar faces here on this call. I've met you through these meetings. But what came together and what I wanted to make sure I shared, and that's really the only reason I brought these slides, was to talk about the Chicago Region Food, the Chicago Region Food System Fund supported the concept through a grant of the Chicago Region Food Rescue Hub. And it's something that has just, you know, we've just received this award. The announcement was last week, I believe, though time is still a little amorphous. And the groups involved, primarily, it's the Chicagoland Food Sovereignty Coalition, which is about 20 autonomous mutual aid groups who have come together and really connected with Brightbeat 7 Generations Ahead, who both are organizations deeply involved in the Wasted Food Action Alliance, and others. And we need more help, especially because we didn't receive all of the funding that we proposed. So really trying to bring partnerships together for a couple of specific reasons. Number one, I want to start with values. And if I've learned anything over the last year, it's that aligning our values and communicating with transparency and openness and love really is the way we can bring about positive change. And so having a neighborhood voice be the basis of our food rescue hub plans is key. And you know, with a prioritization of equity and food sovereignty. The coordination, communication, and food aspect is maybe the less sexy part that I'm more involved in, and really what it means, I'll explain here. What we're planning on doing with the Chicago Region Food Rescue Hub is to assess the food rescue landscape. And, I hope that I'll be, working with you all to maybe make sure we're connected. And I saw Deepa and Bahati here from the Food Navigator. We really are, many of us, working on identifying, I apologize for the fire truck, working to identify what's going on, what assets are out there. It's so interesting, there's gaps and there's needs, but those are as important as the assets. And the assets oftentimes are the neighbors and the neighbor connections and the community groups. And so really identifying all of that, and then determining how we can best improve communication and also redirect food kind of into this system to feed more people, and do so in a way that can exist beyond, the funding of a grant. So that's essentially the concept. Oops. Oh yeah, that's the concept. So good. You don't even have to look at any more slides. Let me stop sharing. I'm going to keep talking, but I thought I might miss something if I didn't show you those. So what I think I want to make you aware of is what we've noticed so far. And I'd love to hear from others in your perspective on the landscape of the food rescue kind of operations here. But what we've seen is the biggest issue is communications, and then kind of logistics. On the communications side, the Greater Chicago Food Depository, for example, receives tons of calls saying that there's food available and they don't have the capacity, or there's certain issues with the requirements around Feeding America guidelines for them to be able to accept the food that's out there, edible, healthy food. And so number one, how do we find a way to work within the system or adjacent to the system? Trust me, that's like a big component in and of itself. But how do we basically collaborate to receive and retrieve that food, and then repack and sort it, and get it out in a way that it can be received by the neighbors who need it. So those platforms, that the Greater Chicago Food Depository is an example of a surplus asset out there. Grocery stores are another example. And work is being done right now to identify a more efficient manner to retrieve food from grocery stores. There is a system that exists, and it has some inefficiencies in terms of what food is captured and how much is not. I'll kind of leave it there. Additionally, there are mutual aid groups and others that are doing great work, and they're connecting via Slack or via an email thread or a text thread. And there's not always a way that they're communicating with one another. The Chicago Food Sovereignty Coalition, I think it was formed, I can't speak for them, but largely to identify, when opportunities to rescue food on the north side or Lake County come, there's south side, way south, and deep west communities that need that help. And so by working together, they can direct food not only from, those who have it to those who need it, but those who are working to improve and help one another. How can they move things within their system, if you will, or within their network, I should say. So that communication piece is a critical juncture or component. And then the last one is the logistics side of it. And I already touched on it, but the physical spaces that are needed to sanitary spaces and all everything associated. Where can this food be received if it's on a pallet? And then how can it be broken down so that someone who has taken a bus can carry this home to feed their family? Or is there going to be a system by which cars can come and pick up and then redistribute to their neighbors? A lot of this is going on, and that's what's so beautiful. So we hope that through the work of our group, not only will we identify what's happening and what opportunities are there to do more with those who have capacity, but how can we build capacity and then work with others who are doing the same. And again, we received this funding, so did dozens of other organizations, but I think I identified about 10 or 12 who are in that kind of community anchor space, food hub. I could go on, but there's just a lot that I hope we're going to find a way to really share resources across. So a few things that I wanted to just touch on that relate specifically potentially to the hospitals who are here on the call is that, you know, I spoke at a Greentown conference in 2019, I believe it was, and there was a discussion around that critical point of communication when a patient is leaving the care of the hospital or the clinic, and what an amazing opportunity in that moment to ensure that they've got resources. And this could be patients who are struggling with food insecurity, mental health, unsafe domestic situations, whatever it may be, a tough financial spot, which is what COVID has done to a lot of people, the families and jobs. So, other printed resources, again, maybe this already exists, but printed resources with physical addresses, phone numbers, websites for free, affordable services. There's food pantries out there I'm thinking of so many things right now, but I know the Chicago Help Initiative does a lot of work with food and wraparound services. I know Fight to Feed has a collection program going on at McCormick Place, which we hope will continue. And they've got, working with Mutual Aid and other, a means to distribute tons of food if they know where it needs to go. But Chicago Food Sovereignty Coalition and Sacred Keepers in Bronzeville also have initiatives. So, does this exist, or how can we, those of us working to try to map and identify these community assets, how can we communicate them or work together to make sure that these patients exiting your care have this information? And then, how do we support those who are supporting others? And I mentioned already kind of the space needs. Cold storage is something, I feel like some of you on this call have heard me say that phrase way too many times, but the need is only going to get more as the temperature goes up. And cold storage, what it does is it takes food that's edible and healthy and keeps it alive another day or however long it takes for these groups to be able to distribute it. Because perishable food today is hopefully compost, not trash, tomorrow or the next day. And on the subject of composting or anaerobic digestion, the recycling of organics is a vital step to reduce greenhouse gas emissions. And I don't know how many, hospitals are already engaged in exploration of this, but I know Rush Oak Park Hospital is doing great across the board with some programs. And then we're working with a hospital in Lake County to explore how they can really up their food rescue as well as diversion of food scraps. So I would just, kind of put it out there to all of you, if you're able to go through that exploration process to capture and redistribute your surplus food and consider the anaerobic digestion to create energy or the composting to create healthy soil of the food you can't use. Those are real ways to support climate resilience and sustainability, which is directly linked to economic justice and social justice, which I know everyone cares about. So I'll end it there. And I know there was a question in the chat, but I don't know if you want me to answer it.
Yeah, you can answer it right now.
Okay. Jess, she asked if we are working on prepared food rescue as well as food from grocery stores. Jess, you're speaking my language. I have been so focused on prepared but not served food because of my kind of event hat that I generally am often wearing. And it's a lesser priority to those in the hunger relief system. They want to get out kind of the easier, the low-hanging fruit, the easier to handle materials. But there is such a need and an opportunity, and organizations like Fight to Feed, it's fight the number 2 feed.org, I believe is their website. And Jawan McCartney is the leader over there. And you know what they've done with McCormick Place has been able to take large quantities of prepared food and break it down. And we've experienced that working at McCormick Place, where there are, I mean, I hate admitting, in 5 days in January of 2020, over 20 tons of prepared but unserved food was composted. Now, great. I mean, it's great that it was composted, but how many community members could have been fed without it? So, Jess, I agree with you. And I think right now there's a little bit less of that because of COVID conditions, but it is going on right now. And I'm interested in doing more of it if ever you want to discuss. And the grocery store work is pretty robust and maybe a longer discussion, but there are kind of a multi-pronged approach to getting these grocery stores who have food that they're willing to give away to help them be able to do it more easily, because I think that's the key.
And Stephanie, sorry, I'm not from Chicago. So like, how does the food end up at McCormick?
Oh, sure. McCormick Place is a convention center. So it's so the food that arrives there comes, you know, it could be Midwest Foods delivering produce and, you know, Cisco and US Foods, whatever. And it's prepared in their kitchens because they're going to serve it. That's when events are happening. Currently, the surplus food that's out there is being coordinated through this organization, Fight to Feed. They've got airlines partners, Kroger, Frito-Lay, you know, don't quote me, but those are at least some that I remember seeing when I've been there. The pallets of food are coming from manufacturers that have, you know, off-spec product that's still perfectly edible. There's so ways like that. So it's a food rescue operation, but with the capacity to accept container trucks, truckloads. So the size of the truck can come in, the docks, just like kind of the logistics of that last mile. And it is that last mile of receipt as well as that last mile of delivery that is I don't want to say the hardest, but yes, it is the hardest and also the most nuanced. And so it's organizations that are really focused in that space, I think, that need the support and that have the opportunity to make the biggest impact, because it's a key component that I think, you know, it's not always thought through. And those who have thought through it recognize the steps that need to happen from a pallet at a warehouse turning into a meal delivered, you know, under the viaduct to a group of community members that are living there.
Right. Thank you so much. That was a great presentation. Before we get to the questions and answers part, I do want either Nicole or Aisha from Advocate to share a little bit about what they're doing with food resilience at their organization.
Sure. Can everyone hear me?
Yeah.
Great. What is this? Good morning. My name is Aisha, and I am the Central Region Community Health Coordinator at Advocate Aurora Health. So I am in the Central Region, and those hospitals are Lutheran General Hospital, which is in Park Ridge, Advocate Good Samaritan Hospital in Downers Grove, and Illinois Masonic, which is in Chicago. So I will give a quick summary of some of the work that we've been doing around food security and food access. So we've really been working to expand, you know, food programming through the hospitals that we oversee. And I say we as in my director, Nicole Edmonds, but she's not on the call. And also my colleague, Elvis Munoz, who really oversees Lutheran. So I'll just give a quick summary of some of the work that we've been doing. So our key partners in all the food work and distribution that we've been doing are Lakeview Pantry, Herbs and Shelley's Fresh Picks, and Produce Alliance, which is a new partnership, and I'll talk a little bit about that towards the end. So we partner with these organizations really to implement 3 different strategies across that whole region of hospitals. So our first strategy is our hospital-based food pantry program, which provides non-perishable food bags to patients that screen screened positive for food insecurity at the hospital. So whether they're a patient that's receiving care consistently, like if they're a cancer patient, that's one of our partners within our food pantry program. So if whether they're a cancer patient or maybe they're coming through the ED and they're being discharged, they are being screened for food insecurity. And if they screen positive, they are able to leave the hospital with a non-perishable food bag. And our key partner in that is Lakeview Food Pantry. They actually deliver the food bags to us on a monthly basis. And then another key component specifically at Illinois Masonic is that once patients screen positive and they enroll in our food pantry program, they are eligible once a month for a fresh produce box to be delivered to their homes. And those fresh produce boxes are delivered through Herbs and Shelley's Fresh Picks. So the boxes are on a monthly basis, and it contains fruits and vegetables, and there also has healthy recipe cards in those boxes that are in English and in Spanish. So through COVID and just really forever, but through COVID, we really noticed that food insecurity is a huge thing. So we've expanded our pantry work. It originally started at Illinois Masonic, but we've expanded it to Lutheran General Hospital and at Good Samaritan Hospital. So that's one of our strategies, is our hospital-based food pantry program. And then actually through that, because our pantries serve typically just our patients, but in response to COVID, we expanded it to our team members that may be kind of going through a difficult time or have been furloughed, or whatever their issue may be. The food pantry is now accessible to our team members. Our second strategy is our pop-up farmers markets, where we provide fresh fruits and vegetables to our community-based organizations and partners that really serve low-income or vulnerable communities. So through that, some of our partners are Community Health, Avondale Faith and Health Collaborative, and Grover Cleveland Elementary School. So again, these boxes contain fresh fruits and vegetables, and they also have recipe cards in those that are in English and Spanish, and those are delivered right to the community-based organization. So again, Community Health is one of our partners in that. And then our third partnership, which is new, and it's really been a blessing and really exciting that we've got to partner with Produce Alliance. Some of you may be familiar with them. But Produce Alliance, we've been working with them since February, where we distribute USDA Farmers to Families produce boxes to our community-based organizations, again, that are serving low-income communities and individuals, and communities that have high rates of food insecurity. So some of those community partners are Avondale Logandale Elementary School, the Council on Islamic Organizations of Greater Chicago, and Esperanza Health Centers. And how that program kind of is being worked, or how it's being implemented, let me say that, is so we identify community partners, and then we actually have Produce Alliance drop each site gets like 252 of these produce, USDA produce boxes. Those boxes are about like 30 pounds, and they contain a gallon of milk. There are like onions, potatoes, apples, carrots. So those are being delivered to our community-based organizations. And then I typically will go on site just to, help with logistics and, meeting the community who we're actually serving. And then we have tons of other resources and wraparound services that come on site when we are doing the USDA produce, farmers to family produce boxes. So no, I know that was quick and super fast, but if there's any questions about how we are doing this, or ways to partner with us, or how we can partner with you, we would love to. Again, that's just a quick summary of some of the things that we've been doing. So I'll pause. And I do see some questions, but I don't know if they're.
Yeah, I see a question from Lindsay asking about which population is receiving the fresh produce boxes from Herbs and Shelley's.
Sure. So Lindsay, we partner with Herbs and Shelley's for two different strategies. Our first is within our hospital-based food pantry program. And this one, this is specific to Masonic. It's not yet expanded to Good Sam and Lutheran. But so when patients screen positive for food insecurity, if they're interested in receiving the monthly fresh produce box delivered to their home, on our intake form, they will circle yes, and then we will follow up with them. So that's one way that they're getting Herbs and Shelley's actually delivers it to their home. And then the second way is through our pop-up farmers markets, which we partner with, again, community health, CPS schools, FQHCs. We deliver those boxes to those organizations, and then their patients that are being seen that day, or their clients that are being seen that day, can grab a box. Of course, we screen them first, but they're able to grab a box of food. I hope that answers.
Thank you. That's very helpful. Can I just ask you, which clinics are you screening in that then they have the option for home delivery?
So that's the pop-up farmers market. So community
No,
health.
I'm sorry. The other one where they're within the hospital.
Oh yeah. So those patients are, how we screen them is by service lines or departments. Hope this is making sense. So
yeah,
we're partnered with oncology, cardiac rehab, care management, behavioral health. So that's internal for our department. And then, okay, great.
And then, yeah, please continue to add your questions for Aisha and Stephanie in the chat. So I see a few more for you, Aisha. So someone's asking about how long, well, Lisa is asking how long do the patients actually receive the food box from Urban Shelley's?
Yeah, Lisa, that's a great question. So they're enrolled for up to a year. So if, let's say they, what is this, April? So if they enroll in April, it'll go through April 2022. And then upon that time where they've been in there for a year, we do refer them to Lakeview Food Pantry. We love Lakeview Food Pantry. They are amazing. And then they will enroll them in some of their other programs. So they have like an online ordering program where patients can, or individuals can, pick their food online and just pick it up, which is awesome. So after a year of being receiving the fresh produce boxes, they're referred to Lakeview Food Pantry, and then they are enrolled in one of those programs. That's a little bit more sustainable for them.
And then someone is talking, Ashley is asking about the workflow for that intake form and who's completed it, who's given it to the patient.
Sure, yeah. So Ashley, the way we have it structured at Illinois Masonic is, so we call them pantry managers, but we work with our service lines internally. So again, behavioral health is one of them, oncology, our care managers in the care management department, our transition support program. So there are our pantry managers because they actually are interacting with the patient, whether they're coming for their appointment or coming to see the doctor or whatever. So we have an application that now is electronic, and we're very proud of that. But we have 2 screening questions on there, and then we're just gathering basic demographic information on who the patient is and what are some other services that they may be needing. So that's how they're being screened when they come in for their appointments, or like if they've been admitted to the ED and then they're being discharged, a care manager will meet with them before discharge and ask them, are you asking the 2 screening questions. We use the Vital Hunger screening tool to ask those 2 questions. So basically, to answer your question, it's our pantry managers, again, which could be behavioral health staff, it could be oncology staff, it could be our care management team. We even have, we recently expanded to our OBGYN clinic. So those nurses that are working with the moms, and when moms are coming in for their care, they're also screened for food insecurity. I hope that answers your question. And I could share our intake form if that would be helpful.
Yeah, it seems like there's a lot of interest. So a couple of other questions are around how much, like with Urban Shelley, how much does that cost your organization? And then Jen Hurd was also asking about how are you covering the cost of those programs?
Yeah, so we have been very fortunate. So we have a budget, our community, I don't know if I mentioned this, but I'm in the community health department at Advocate Aurora. So we have a budget at actually each of our hospitals. But for Masonic specifically, which is where they're getting the fresh produce delivered to their homes. So we have a budget, and then we also, we applied, so we have this thing called the President's Fund at Illinois Masonic, and it's a fund where the money is like raised and then it's given to programs in the hospital. It's like a grant that we apply for every year. So we've been awarded money for the past 3 years to continue and implement and expand our work through the hospital-based food pantry.
And then Lisa was also asking and if you could explain the USDA program again.
Yeah. So we've been working with Produce Alliance. That's the organization. They got a bid from the USDA to do, they call them rounds, but the rounds of the USDA Farmers to Families produce boxes. So they reached out to one of our contacts within Advocate Aurora, I think actually with the development and our foundations team. And then they reached out to us, our department, Community Health, saying that, you know, we do work regarding food access and how we can really do more than just give like physical health care to our patients, but how can we really address those other needs that a lot of times affect their health. So I think it was a connection through our foundation and development team on how we got connected with Produce Alliance, but they got a bid from the USDA to distribute these produce boxes. So when the opportunity came to us, we immediately started identifying our community partners, again, that serve low-income communities, individuals, families, and a lot of our work has been kind of pushed through our faith-based, like our churches and networks like that, where we were able to distribute these produce boxes. I hope that answers your question. And if not, I could put my email address in the chat and I'm happy to answer any other questions.
Seems like we need a completely different discussion for all of this, but thank you, Aisha. Jen, did you
Thank you
have
all so much?
No worries.
Yeah, hi.
Yeah.
Thanks, Sydney. This is Jen from CDPH ASHIA. Thank you for your presentation. It's so wonderful to hear all the great work that you're doing, and I think it could serve as a model for some of our other hospital systems as well. As follow-up to the question I asked about the resources that you're being utilized to cover the cost of the programming, when you mentioned you're in the community benefit section, so were community benefits a component of the resources to pay for these programs?
No, I don't know. So our department, we do community benefits, but we have a budget that I don't know how to really explain this, but we have a budget that we get that like everyone gets, I guess, yearly. So based on that, we allocate resources towards our food programming, and then we get so we apply for this President's Fund, which is specific to Masonic. I don't know if other hospitals have that program or resource. But so we apply for that grant, and I have hundreds of other departments applying for this grant. And then, they kind of divvy out they allocate how much each, where we request like $10,000. I think this year we got 9,800. So that's how we really are that's how we are purchasing the food, because the Lakeview Food Pantry, that's of no cost to us. Well, we give them a sponsorship, but it's at really no cost to us. And then for the Herbs and Shelley's Fresh Produce, we do use our President's Fund award to pay for those. I hope that addresses or answers your question.
Sure, that's helpful. I guess another follow-up to that then is, how will you build in your sustainability to ensure that the program continues after the presidential grant may not be awarded in future years?
Sure.
Have you guys thought that out?
Yes and no. So we would continue to look for grants, and then either internally within our hospital system or outside the organization. But then again, we still have a budget that comes from like the hospital that we will, before we were even receiving the President's Fund, we were using our budget from the hospital. I hope that answers your question.
Yes, thank you so much.
Mm-hmm.
This is Lindsay. I would love to see our work group working on ways that, to Jen's point, funding could be tied to screening for these supplement provision of food above and beyond just referral to community-based organizations.
I so agree, Lindsay.
Yeah, because we're philanthropically funded. We also have community health grants within the institution that are given to clinical and community work, but it's not a sustainable model. So we have an opportunity, because now that social influencer screening has an opportunity to have increased reimbursement for us as hospitals, we need to work on ways where we can get analogous to the Ryan White work for HIV, where food provision is a reimbursable expense, depending on where somebody is in the care continuum of that diagnosis. But I think we, as a hospital, like this is a great group, since there's so many hospitals and other organizations who would benefit from if we could get this reimbursed.
Yeah, that would be awesome.
Thank you, Aisha. And then to Stephanie's presentation, you know, just particularly around the point of redistributing food, I wanted to get a couple of people's thoughts, especially the hospitals that are on the line. Like, any thoughts around that? Is anyone working on something like that?
Well, I know there's the Food is Medicine group, and they actually has some legislation about what just Lindsay just said. And I can't remember the name of it, so I would suggest, I'm going to put the link in the chat for the organization so you guys can take a look at it, because there's some promising things, and it is kind of based off the Ryan White funding model. They're starting with diabetes, so it will probably start with some type of health diagnosis, before it expands to like this type of model that you're talking about now, but it's going somewhere. So I'll drop that.
Thanks for doing that. Is anyone else working on?
I don't know if anybody from Rush is here, but Rush is clearly working on some food rescue stuff. We make our food to order, so we have less waste as a result of that. So we are happy to partner on initiatives to tackle food waste, and it's obviously been, I think if there's lots and lots of trucks on the road. So the issue is, how can the trucks on the road be used when they're empty to pick up food rescue and then get it to organizations who have the capacity to accept it? And that's why the idea of a hub is so exciting, and that they could, GCFD delivers food during the day to a pantry and then goes back to GCFD with an empty truck. Or sometimes they're picking up Starbucks stuff and dropping it to their pantry network members. But if they could pick up stuff and send it to this regional food hub, so it could be stored until pantries could come get it, that's an exciting model. So tapping into the trucks that are already out there that are empty at some point during the day or night, and finding a place to put it, it would be really exciting.
This is Lindsay from Northwestern. I need to check with my colleague Holly, but I know our nursing staff is picking up food during the day and taking it to different locations. But I don't have much more information than that, and I can find out more details. But to Lindsay's point about the trucks, I believe that there was a similar initiative that was happening with the, supplies. Like when we have medical supplies come to the hospital and then they're leaving the campus empty, how can we use a food hub similarly to send those empty trucks back with food back to the food hub? So I know Project Cure does it, I believe, right now with medical supplies.
Awesome. All right, well, thank you all for such a great conversation. And it sounds like we could keep going, so maybe we can definitely touch on this again in the future. And I also just want to thank Aisha and Stephanie again for sharing their thoughts. So much great work going on, right? I did want to share my screen really quickly for our second discussion so that we can still have time for the CHNA work. Let's see. All right. So, whoops. This discussion, as I said previously, is really about we're wanting to hear everyone's thoughts on leveraging contact tracing and vaccine distribution efforts for food security work. So I have a few questions here that I just want to spend a few minutes on before we move on to our next discussion. So we're just wanting to know, has your organization been identifying food insecurities through contact tracing efforts, or do you know of healthcare organizations or other organizations that are currently doing this? Are there ways to address food insecurity during that contact tracing process or vaccine distribution? And then what are the opportunities for a broader system approach? So I just want to open the floor. Does anyone know, is anyone working on this firstly?
Hi, I can speak briefly about this. I work with Circle. I'm on the social work on the team, but we do this work, and I have some data for you guys, just some quick numbers, and then I'll go through it a little bit easier. But at this point, when people come into any of the Circle community testing sites, they get surveyed, right? Part of the survey is asking about food insecurity or having trouble to pay rent or make ends meet. And this has been like 17% of the 275 people that want to be followed up by our team, right? So we've noticed that the people that we've been able to provide these resources, 62 of them have, 62 of these people, 23 of the food insecurity resources are being provided to them. So what we would love and what we're getting from this call is, really expanding those resources that we can provide, because if WIC and SNAP or these food pantries sometimes aren't enough, and we're realizing that this is becoming a really big issue, not just because of the pandemic, but for other reasons as well, correct? So those are just some numbers from, this is Bellwood, this is Berwyn, and this is Maywood. And if these is just like a small portion of individuals, we can imagine on a larger scale what people are going through. So yeah, I'm not sure if that answers your question directly, but we're definitely trying to make all these different connections and see what our social networks can gain us, so that we can spread the word to these individuals when we call them and follow up and send these resources through email or through mail.
Thank you for that. So yeah, it does seem like there's some opportunity for us to collaborate, maybe so that we can have a better referral system. Do others have thoughts around that? Is anyone else working on it?
Yeah, hi, my name is Madeline Butler. I work with Yuli in Circle, and I am the dietitian nutritionist there. And Circle, I want to clarify what is Circle. And Circle is the COVID Equity Response Collaborative at Loyola. And this is a team of public health, a medicine, nursing student, a law and social work, and a student too, and another professionals working in partnership with community leaders and public health officials to minimize the negative impact from COVID to vulnerable communities in suburban Cook County, in particular in West Suburban Cook County, and these are the community around the Loyola Medicine Maywood campus. My role as a community nutrition liaison is to find access to nutritional food and information to those participants to visit the centers, because we have a testing centers where people go and test and get tested for COVID. And we provide a package to those participants that include food resources around the area, food pantries, and all of that. And we also partner with a VeggieRx in Maywood, that Mary Mora is also in the car, that is in this call, that is the lead for VeggieRx, to provide some food to those participants who come and get tested for COVID, right? And Julie is another member that talked a little bit in the beginning. And we also provide town halls through Facebook and YouTube Live. And for example, we have one in English about staying healthy before and after COVID. And so, yeah, for the community to see and learn about everything, resources and all in the area. And we also provide that in Spanish, that is gonna be today in our Facebook and YouTube page. by me. So if you wanna recommend people to go see, and
Thank you for that. And then I do see a comment from Stephanie asking if you could share the unmet needs survey.
Yeah, I'm putting it right now in the chat. I was trying to figure out how to best do it, but I'm going to do that. And then alongside these, there's some with vaccine questions that we just implemented into the survey. And then of course, there's some like demographic, like sex, gender, name, where they're from, like what city, state, all that good stuff. But I'm just going to focus mainly on the later portion of the survey.
Cool. Thank you so much. Yeah, I could definitely see this being another discussion. So we'll definitely be following up with both of you. Thank you so much.
You're welcome.
Awesome. I do want to move on to our very last discussion about the community health needs assessment overview. So I'll pass the mic to Jess right now to give a background context before we move on.
Thanks, Sydney, and hi, everybody. I know that a number of people on this call are very familiar with the community health needs assessment process, and then there are others that are less familiar. So we're just going to take literally 2 minutes to give a little background, and then we're going to break into breakouts to get some of your input. So just as background, and maybe move to the previous slide just so that we're not overwhelmed by the content here. Just as background, the Alliance for Health Equity, as you all know, is a collaborative of hospitals and other healthcare and public health and community partners. One of the things that we do, and that sort of forms the foundation for this group, is a collaborative community health needs assessment across Chicago and suburban Cook County. So under the Affordable Care Act, the federal level, all nonprofit hospitals are required to do this community health assessment every 3 years, which, you know, is maybe not an ideal timeline to be assessing every 3 years, but that's what the requirement is. And so, drum roll, we are coming up on the next round of community health needs assessment. And so one of the things that we're trying to do this time around is really to build on the already identified needs and really focus around what are the strategies that we've been discussing today that really require partnership, and getting input around how to advance and strengthen those strategies, and understand what barriers and opportunities there are to being able to advance this work. Because, you know, unfortunately, we all know that food access and food justice will continue to be a priority issue that comes out of the assessment. That has been made very clear over the past year. So it's not a question of whether this is a priority, it's a question of how can we strengthen partnerships to address it. So with that background, we'll send around these slides, but we can move to the next slide. We do have over 30 hospitals in Chicago and Cook County that are working together on this assessment, along with our you know, key partners at the Chicago Department of Public Health and the Cook County Department of Public Health, as well as all of you on the line that are other community partners. Just to highlight here, I think this sort of speaks to what I was just saying, which is we really want to take an asset-based approach. We want to look at how to build on existing strategies and partnerships. And part of that approach is really to gather your input today. And then we will be having some more community-based sessions. Probably most of those will still be virtual in this environment, but really gathering input from community-based stakeholders. So it's a several step process, but we want to start it here with you all to really refine what are some of the questions that we want to ask to be able to strengthen partnerships through this effort. Just to also note that most of the hospitals are required to post their community health needs assessment and implementation strategies some point next year in 2022. The exact date varies based on the fiscal year of each institution, but we, you know, all of the hospital reps on the call certainly understand that, and just making sure that everyone else is on the same page as well. So moving on to the next slide, just to note that we're taking a variety of assessment approaches here, and really coming at this from a equity and asset-based approach. Next slide. Next slide. Okay, so as part of this assessment and planning process, we want to really take advantage of having this great group of experts on the call today. We're going to break out into, I believe, 3 groups now for small group discussion for the next 20 minutes or so. And you can see on the right-hand side here, the strategy areas that we'll be discussing should echo a lot of what we were already talking about today, which is great in terms of really centering racial equity as it relates to food and nutrition security, and thinking about the best ways to support BIPOC and women-owned food businesses through these efforts, thinking about coordinated or aligned referral systems, ways to have better evaluation and measuring the impact of our work, and reimbursement for food as medicine initiatives. So many of the things that you all have already brought up, and we're going to dig a little bit deeper into some of the opportunities and challenges related to those. So I'll turn it back to you, Sydney, to describe what happens next, but I think it's primarily everyone will get put into a group.
Definitely. Okay, here, let me clear my screen. So yes, Jess will be a facilitator for one group. I'll be a facilitator for another, and then Rebecca from our team will also be another facilitator. So we'll put, thank you, Lucy, for putting the link to the Google Doc in the chat. So we'll be following that and asking the questions to you all, and then you can verbally respond or put it in the chat, and then we'll be recording and taking notes. So we'll do that for about 15 to 20 minutes, like Jess said, and then we'll come back to the main room for a quick report back and wrap up. So Lucy, just let me know when you're ready for us to go into the breakout groups. All right, I'll give it a few moments for people to return to the main room. Awesome. All right, so either Jess or Rebecca or anyone from those two, well, I guess we can start with group one. Do y'all have any summaries or topics that came up in your discussion that you'd like to share?
This is Jess. So I was group one on paper, so I'll go with that. So yeah, we had a really great discussion. I'm not going to attempt to distill it in 1 minute, but just really appreciate everybody's input. And I think that the strategy areas really reflected a lot of the discussion we already had earlier today. So we'll plan to consolidate all that. But Rebecca or Sydney, if there's anything you want to share in terms of specific insights, please do.
Rebecca, did you have anything?
Yeah, sure. We also had a really rich discussion. We really know it was kind of hard for us to move beyond COVID, I think, for the larger question, thinking about what are some things we should think about with strategies. But I think we also realized that this is a really good moment to start thinking about some of the ways that we could use what we've identified. So something that came up that Stephanie mentioned was thinking about the ways that we work with BIPOC contractors right now, and thinking about just not only operations, but thinking about recycling, composting, and the ways that we do things, and how can we use this moment to kind of rethink some of our methods moving forward.
Love that. I know group three on paper, we had a very, very good discussion as well. Lots of great thoughts. And then particularly like thinking about other models that are out there and how we could maybe think about that, you know, when we're trying to create these new solutions, and then connecting platforms, so like Now Power and Bertha or Epic, how to connect those or use other existing models for sharing that data so that we can start to make a move. And I think someone mentioned like moving from talking about something to actually creating action and doing something about that. So anything else others want to share before we wrap up? All right, any questions for the Alliance for Health Equity team that we should address? Okay, well,
I have a question.
Go
It's
ahead.
Jen. So I know Jess mentioned at the beginning of the presentation that it says the beginning of the process, but will you guys continue to include us in your process and allow us to provide some feedback along the way as well?
Yeah, thanks for asking that, Jen. I should have been clear. Yes, our goal is really so at each of the upcoming quarterly meetings of this group, we will definitely be referring back to where we're at in the CHNA process and collecting additional input and feedback from you all. So yes, that is definitely the intention.
Yep, we value everyone's perspective here, so love to have you. Okay, well, our next meeting is on July 29th, same time at 10 a.m. on a Thursday. So I look forward to seeing you all there and continuing our great conversations. And let me make sure checking the chat. Cool. All right. Thank you, Stephanie. All right. Well, if there's no other comments, I hope you all have a great rest of your weeks and take care.